We will then go right into our 6:30 joint meeting with the Board of Health and Board of Selectmen. So I will just read again the statement because we're participating remotely. So real quickly, pursuant to government, oops, sorry. Karen, I didn't tell you to start. Great. So that's all captured on tape. So welcome everybody for my screw up. Now you know. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, Mass General Law, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Board of Selectmen and the Board of Health of Westborough is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to view this meeting while in progress may do so by turning to Westborough TV government channels, which is Verizon Channel 28 or Charter 192, or streaming online at westboroughTV.org under the live stream government link. So we have one agenda item on here, which is a discussion vote to consider request to dissolve the purchase and sale agreement for property located at 9 Grove Street. I'd like to open this up to a motion. Selectman Emery, do you have a motion for us?
Yes, I do, Mr. Chairman. I move to terminate the purchase and sale agreement for 9 Grove Street.
I second.
It's seconded by Selectman Edinburgh. As discussion on this, this has been on our agenda for a few times and has been subject of discussions in executive session. We did receive back one of the due diligence we were doing on this property was to do an environmental study on the property, and we hired environmental consultant Ty and Bond to do that. We received the results back from that at a cost that we absorbed through our legal budget at the time to do that testing. We chose Ty and Bond as they were also the environmental consultant we used for the adjacent property, which is now the Westborough Fire Station. But when we purchased what was known as the former VARC building, they did the testing and continue to do the monitoring wells on that property. The results of their phase 1 study was that the town should conduct a more extensive phase 2 study on this property as part of the due diligence. Well, we anticipated that, and that was included in the warrant article that at present is posted for our upcoming town meeting. In light of the COVID-19 situation and the multiple rounds of budget cuts of the town's been working on, as we've experienced and continue to expect revenue shortfalls, we feel that kind of moving forward with these environmental considerations and going to a phase 2, which indications will be $20,000 or more for that. And if determination is made that that would not be, that cause us not to move forward with the property, that is money that the town would spend and not recuperate that money back. So I think the motion that we have here to terminate the purchase and sale as it relates to the environmental conditions of the property is the purpose for that motion. Any other further comments or questions on behalf of the Board of Selectmen? If not, I will go to a roll call vote as required. Roll call vote, Selectman Emery.
I agree with the motion. Thank you.
Selectman Marshall.
Marshall, yes.
Selectman Edinburgh.
Edinburgh, yes.
Selectman Hashmi.
Yes.
And Selectman Johnson, yes. So that's unanimous, 5-0. And with that, I notice it's 6:29, so almost 6:30. So we'll be moving into our joint scheduled session for 6:30 with the Board of Selectmen and Board of Health. I know the full Board of Selectmen is here. I haven't been watching. Dr. Walsh, is your board here? Are you still waiting?
I am here. I have not seen Dr. Ehrlich join yet.
Okay. He still has a minute, so I'm jumping a little early. We did have John Arnold, town moderator, I saw join. Wendy Mickle, town clerk. Members of the Board of Health, our building commissioner, our recreation director, well, among others. I apologize if I've missed you. And Nathan, what I'll do is once you're ready, I think probably when your full board is here, I'll turn the meeting over to you, as we typically do for these meetings.
Yep, I'd like to just wait a couple more minutes to see if we can get Dr. Ehrlich to show.
Perfect.
Nathan, while we're waiting for Alan to join, are we going to be? I'd sent an email about do we want to give guidance to the town? I know John is going to be talking about the town meeting, but do we want to give guidance to the town regarding reopening, or our thoughts about reopening, or share those thoughts?
Yeah, I mean, it would be good if we could wait for Dr. Ehrlich. He may have something that came up that's preventing him from coming in. I don't know, Steve, if you can.
I just talked to him. He's getting on.
Okay.
He should be on momentarily. Yep.
But yes, I think as part of tonight, Dr. Hatchme, we should, update as to kind of what the state is thinking of reopening, just in case people haven't heard it from some other avenue.
Dr. Walsh, I do think there's some other pieces related to that that we have folks on that we want to cover as well, specifically related to the information that came out yesterday afternoon from the governor around restaurant reopening.
Yeah, I think that restaurant reopening, the rec department, and the other thing I think that was on our list was how to deal with some of the seniors that are working to do the tax write-off.
Okay.
So I think those three issues. Steve, was there one other issue that we wanted to talk about tonight too?
Yeah, town meeting.
Oh, tell me, that's right. Yep. So Dr. Ehrlich, have you joined? Do you have sound?
I am on.
Excellent. So with these, we can tackle them in any order, but with John Arnold on, I was thinking maybe it makes sense to tackle town meeting first.
Nathan, did we want to do our typical update, or do we want to?
Oh, yes.
That?
Let's do the typical update first. So this was actually a pretty good week in comparison to others. So if Steve Sakari, if you can update the Board of Selectmen.
Yep, of course. So since last Friday, we've had 8 new cases and one death. So that's where we're at right now.
And of those, I think you were telling me earlier that some of these cases represent tests that may have been done a while ago that you're just getting now results for, and so they show up now, but they're not really new from like this past couple days.
Correct. At least one of them was, I think I explained maybe last week or the week before, we had a mislabeling of an address. So at least one of those was associated with that a problem. So, really it's 7 new cases and one that, should have been reported mid-April actually.
What does that bring our total to, please, on both ends?
Oh geez, shit. Sorry, I didn't do that one, Shelby. But I think we
Sorry.
were at three. I think we were at 350 last Friday. So if you add 357, give or take. I think that's where we're at, give or take.
Now,
Sorry
did you
about-
send out an update for today, Steve? I didn't see it.
No,
Uh,
usually just on Fridays.
Just Fridays. Okay. We switched to just Fridays. Okay.
Dr. Ehrlich, is there anything that you wanted to add in terms of context for numbers or anything, or are we all set there?
You know, I obviously I made comments for last Friday's report that I think are relatively unchanged. The one thing I would say, and what I'm going to say, I'm not sure is 100% correct, but I'm pretty sure this is. If you're looking at the state numbers, you may have noticed on last day or two there was a big spike up, and I believe that was due to a change in the state's reporting methodology, where they were now considering presumed case. They were including deaths of presumed cases. And so they had a sort of a one-time adjustment, but the numbers in the state otherwise, except for that day, have been doing quite well.
Yeah, and so for our numbers, we've been kind of treating presumed cases as actual cases all along. So we're not expecting a bump because of any of this change that the state is doing, correct?
That's correct.
Good.
Are you
Um,
expecting a bump due to the non-social distancing and several events that have happened in Massachusetts?
We're
Yeah, so I
definitely
think-
watching. Oh, go
So
ahead.
I think that remains a very interesting question to watch. Obviously, one of the differences, even without social distancing, is that this is in an outdoor, sort of low humidity environment. And so, you know, the same factors that predispose to easy transmissibility may not be at play. So I don't know how much we're going to be able to infer, but, you know, you have to assume about a 2-week lag time. And so, you know, by the end of the month, we'll know if there was an effect from these gatherings.
So are there any other questions about the numbers from the Board of Selectmen?
No, thank you for that.
Good. So if we can go on to the town meeting. So John, you've asked us to look at some issues. It'd be great if you can just kind of restate some of those questions you were looking at, and then we can try to address those.
Yeah, sure, great. Again, John Arnold, town moderator, for anybody watching who doesn't know me. Getting a little bit of a head start. The town meeting that we've postponed till June 20th is now less than 3 weeks away. And I want to make it clear, I'm not expecting any decisions tonight. I mostly wanted to make sure that the conversation had been started, because my goal is to advise voters of whether we think we're going to have a go, no go on town meeting on June 3rd, the town meeting to be held on June 20th. I'd like to be able to piggyback some publicity off the June 13th town election with a sense of whether we think June 20th is reasonable or not. Now, as we've gotten closer and as the state has started to open up, things have gotten a little trickier. I think the past couple times I've waited for 2 weeks since the previous postponement, because it was pretty clear that we were still pretty far away from being able to have a town meeting. But now I think there is some likelihood that town meeting may be able to happen on June 20th. So I just wanted to start bringing some questions and for you to consider, because as the Board of Health, along with the Selectmen, just getting the pulse of the board and the director of the health department and the Selectmen want to get a sense of whether we think it's likely that June 20th can have a town meeting. So let me sort of triage the questions. The overarching question to think about over the next few weeks is, do we think that June 20th will be feasible to have a town meeting on June 20th? And then the caveat with that is it's likely, I believe, that if that is plausible, that there would be safeguards the Board of Health would recommend. For instance, obviously, we're still in an era of distancing and wearing masks, but there are a number of questions about that. So if we believe that there is a way to have a town meeting, then I think it's to all of our best interests to inform the voters of what the safeguards or what the restrictions would be put in place are. Because again, as part of town meeting, we want every voter to make their own decision about whether they feel it's safe enough. But if we think that it's safe enough then I want to make sure it's clear. So that's the first overarching question, is to think about whether we think there's any way a town meeting can be held on June 20th. Last time I spoke with you, we mentioned that some towns are going with an outside town meeting. Some people are going with an inside town meeting and finding spaces that are large enough to accommodate the distancing. And I'll just raise, I know Wendy Mickle is online, and if she wants to unmute later, she can join in. But I will say that Wendy and some others have pointed out a number of difficulties that an outside town meeting brings. And so although an outside town meeting does offer some more sense of fresh air and spreading people apart, there's the weather. There's either having people sit in the sun, sit in the rain, have to do a rain date. There doesn't seem to be a practical, affordable way of being able to do a projector that would be bright enough in the afternoon sun to project the motions that we're used to. And I know the last time I spoke with you, it was unclear whether there was sufficient science to say the only way it could happen was outside. To counter that, I believe that if again, based on your insight as physicians and as the Board of Health, I've provided information about 2 large volume rooms in town that seem to have at least adequate ventilation. The auditorium at the high school also has air conditioning, and also the high ceilings of the auditorium and the large gym at the high school. It's not your typical small meeting room, but it does provide a lot more airspace. And I've been speaking with people from the school department to figure out how many people we could fit in at a 6 to 8 foot distancing. And so to me, I'll say that most of the people, I think that were on the meeting with the Finance Committee and the Selectmen last night, where this came up as part of the Finance Committee's conversation, I think that there are reasons, there are process reasons to prefer an indoor meeting, but obviously the health issues override all. And again, I would look to the Board of Health to help determine not only making the call about a June 20th town meeting, but also about determining what the appropriate safeguards would be in terms of expecting all voters to wear masks, coming up with procedures that the town clerk and I and the people who sort of staff the town meeting could, in terms of have people use microphones but not touch them, and maybe sanitize them after people speak at them, or let people speak with their masks on. But that's setting the stage. Again, my goal is to try to, although I realize in these times that at the very last minute something could happen that we would have to postpone the town meeting again. But if we feel that there is a feasible way for us to have a town meeting on June 20th, I'd like to give the voters and the staff and everyone involved in town meeting as much notice as possible, so people can start planning on attending and thinking about their own personal decision about whether to attend or not.
Thank you. Yeah, so Dr. Ehrlich or Dr. Hashmi, do either of you have strong input, or would you like me to jump in?
I do, and I'll wait for you, but I have some comments.
You can start if you want.
Well, so a couple of things. One, my first thing is, and this is something that we've talked about before, that exposure or successful infection depends on exposure to virus times time. And so one of the concerns that I have is that our town meetings are never short. They're at least between 10 to 11 hours long. Now, granted, this may be shorter, but at least we're looking to 6 or 8 hours of potentially vulnerable people being in the same room together. The other thing that we need to also communicate to our residents is that we do not completely know the risks yet. The third is that, just literally this weekend, so 2 weeks from now will be June 14th, 15th, is when we'll find out where we stand with regards to outbreaks. But the thing that concerns me is that there was a New England Journal of Medicine article and editorial, which I just want to read for just a minute. It came out on May 28th, the May 28th, 2020 edition, and it's about asymptomatic transmission in nursing homes. Now, so remember, nursing home patients are the most vulnerable, right? And they're supposed to be the ones that are the ones that are supposed to be symptomatic sooner, as opposed to young people who remain asymptomatic and don't get sick. Nursing home patients are supposed to be symptomatic. They're supposed to get sick. They're supposed to go to the hospital. Now, in this study, in a skilled nursing facility in Washington State, there were 27 of the 48 residents that were tested were asymptomatic. So again, a high-risk population with 27 out of 48 residents asymptomatic. Now the question is, again, and Dr. Ehrlich can speak to this, we do not know at this point what the prevalence of COVID-19 is in Westborough. We know that, yes, the rate of transmission is going down, all these wonderful things are happening, but how many people are asymptomatic carriers is not yet known. And all of these people are now going to be congregating in an enclosed space, granted with some sort of air circulation, but for a prolonged period of time. And the thing that gets, and the last comment I'll make is that we are all concerned, I see these pictures of super spreader events. My concern is we are about to hold a super spreader event in our town. And it's all for the right reasons. We're not having a wild party. We're conducting town business. But the Biogen meeting in Boston seeded the COVID-19 outbreak in a sense. And I just, things are, anyways, those are my concerns. Thank you.
I just want to hop in. I realized I said something last night that I forgot to say now. I'm raising these questions. I just want to make it clear. I'm raising these questions not because I'm all gung-ho on having the meeting on June 20th. I just want to make sure the right people are asking and thinking about the questions that have come to my mind. And I'm certainly, so I'm not here to, I'm not going to push the argument of having a town meeting on June 20th. I just want to make the call for the right reasons.
No,
But
and my other,
that's I am.
and John, my other question is, what is our liability as a town? I hate to say this, but what is that? Does anyone know? If we have this town meeting, if people get sick,
I think that you have to have a little bit of personal responsibility with anything that we do, whether we have a town meeting or not have a town. People have to make individual choices. I mean, we want to give them the best advice we possibly can, but ultimately, I think that people have to make up their own minds about whether they want to do something, because individual people's situations vary greatly. You could have someone who's immunocompromised, has no immune system, would be much more likely to get it. You could have someone who's very healthy and not at risk of picking it up. And so people have to use a little bit of their own judgment, I think.
And also, I think the only places where litigation is in process is where, like, meat packing companies have insisted that workers come back to work. I don't think there's any information about people saying, well, I went to this party or I went to this meeting and I must have gotten my COVID there and we can prove it. Now I can sue that entity. I don't think there's anything out there on that.
Well, also
No.
don't forget that town meeting is specifically exempt from the gathering restrictions. And so I think that right there, that speaks to the town's liability.
Well, what I would say is, and this gets to, I think, John Arnold's points, that in any situation, excuse me, in any situation, you have to avoid gross negligence. And so having appropriate safeguards in place that are reasonable and prudent would probably be sufficient to address that concern.
I think that's very good about the liability, having prudent restrictions on there. My feeling on this approach is that things are actually in improving shape right now. The number of cases that we're getting, per week, it seems to be going down. In terms of the kind of hidden level of cases that are in town because of people that are asymptomatic, I think that if you use a number that's kind of close to 50% of the cases are asymptomatic and 50% are symptomatic, that would mean that of the 8 new cases or 7 new cases, that there might be 7 people out there that do have it and we aren't aware. So ballpark numbers, there could be some people in town that are asymptomatic. The question is whether that number is getting worse or getting better with time. I think that if it's a downward trajectory and that is becoming rarer, then my gut feeling is that by June 20th that it is feasible. I think that we'll know better as the 2 weeks go by that approach town meeting. If the numbers seem like they are going up and spiking upward, that could really indicate a risk. But if the numbers are continuing to trend downward, it's I think feasible, and then we have to start figuring about what do we want to include. I think earlier in an earlier meeting we were talking about outdoor versus indoor, and I'd like to agree with the rest of the board that said the outdoor is definitely a safer method of doing it. I do understand that the logistics go up quite a bit in terms of trying to host an outdoor meeting. So from our point of view, I think that can we do a safe meeting indoors is a question that I think is very relevant here. The safeguards of 6 feet apart, I think, drastically reduce the amount of spread of the virus, so that it really then becomes the people that are, even within that 6 foot radius, the nearest person to you during the meeting. There may be, 3 or 4 people that then are, just at the edge of that radius. It's very different than the meeting that Syed, you were talking about with the Biogen, where people were sitting at a conference room table. They were, a couple feet apart, facing each other, talking right into each other, shoulder to shoulder next to each other. There's definitely some big differences between the way we would do this meeting and that meeting happened.
But Nathan, I agree. But the fact remains that we're going to be congregated in an enclosed environment for a prolonged period of time, and we do not know. I guess that's a concern of mine, that we will have, especially the many of the people that come to we talked about this a little bit yesterday. Many of the people that come to town meeting are senior citizens, and so I just worry about their risk. I guess that's the best way I can put it.
So, Syed, I think your points are certainly valid. The question comes, at what point would we feel it was safer to have town meeting than if we don't do it in, let's say, 2 weeks? We have a downward trend. We know that come the fall, things might, there might be a second wave that's been speculated. We don't know. Maybe it'll happen. Maybe it won't. But whenever we have it, it's unrealistic to expect there'll be no COVID-19 circulating in the community. There may be low levels, and the trend that we're seeing now is in that direction. But I'm going to be surprised if throughout the summer they don't continue to report at least some new cases, albeit at a lower rate than what we certainly have experienced in the last 2 months.
So, Alan, is there going to be? Are we as a board? I'm just raising this as to answer John's question, because when in the email he said he potentially talked about dividing. So I'm just wondering, because, and John, please speak up. Correct me if I'm wrong. The gym does have a door, right, that allows open air. Am I getting that correct?
Yes, there's at least one or maybe two, and I'm going to do a visit sometime soon. That doors that can actually open outside as emergency exits in the large gym, and there is at least one door up by the stage that could be left open in the auditorium.
Okay, so potentially, I mean, just so I'm just asking the board that would we, if there are doors that are open in the gym, would we prefer to have the meeting in the gym with the majority of people there and put a restriction on the number of people that go into the auditorium, and put, because that's the place that concerns me most, is because that's recycled air. And John, correct me again if I'm wrong here. Is the auditorium, it's AC and recycled air, right?
There is one door that can open to the right, but it's off to the side of the stage up where I normally am. But I'll let.
Syed, this is Shelby. I think Lee made a great point at the meeting last night, which is a number of people need the auditorium chairs in the arms on them to get up and down.
Oh, right. Sorry, yeah.
Yep.
Yes.
So when we think about our senior population, I think having the
Right.
gym exclusively available would be problematic.
No. I'm just saying that we divide the. I mean, I'm just saying that we limit the number of people.
Yeah. Okay. I just want to
I'm
make
just
that point.
asking my board. Yeah.
Yeah,
So
the,
I'm just
the
asking
concern
my
I
board.
have about the auditorium seating is that to put anybody in the inside part of the seating means that they would have to climb over somebody in order to get in there. And that climbing over somebody to get up or get out, or to have everyone in the row get out in order to have anyone get up or down, presents actually a pretty big hurdle. So I think we would be left to kind of just using the seats around the edges, which has its own set of issues in terms of number of people you can fit.
I think we need to probably do a walkthrough and get an estimate as to how many people we think we could safely seat in the auditorium. But I do think we would want to use both. And it sounds like, for a variety of reasons, it may be. But I don't think the risk at this time of year between outdoor and indoor is going to be materially different if we have appropriate spacing indoors. Both of those rooms have a large volume of air, and so with the appropriate number of people in each room, I think they can, and especially with people using masks, I think it's realistic that you would be able to have a meeting safely.
They also have a large cafeteria. They have a large cafeteria and a large library. So they have a large foyer. So there are quite a few other spaces within the school.
Yeah, again, I want to point out, yes, the reason I am thinking of doing multiple rooms, just because it would allow even greater spacing. So, for instance, if we needed to go to 8 to 10 feet, I just want to point out the problem with going to more than 2 rooms is that for every room we have, we need to have a deputy moderator, and we need to have at least audio, and it would be preferable to have video. Now, as a town, we have experience with running 2 rooms. We don't have a lot of experience that I recall running 3 or 4 rooms, but but it doesn't mean we can't choose that if we want to go with a 2 room so we can spread people out more, limit the number of people who need the armrest, cushion chairs to elderly or people who have a need for it, and then have people spread out. So I think, my inclination, again, relying on the medical and the health department advice, is find the 2 or whatever rooms would work best. And then we work through what are the caveats in terms of spacing and everything else, and then work with the schools and Westborough TV to figure out how we can get it wired appropriately.
And John, I think you've chosen. I mean, there's a reason why we've used those 2 rooms in the past.
Right.
I think they're large volume rooms. They're relatively contiguous. We know that it works from a, kind of an audio visual perspective. Been well tested. I think those. Personally, I think those are the best rooms that we have. And I think Dr. Ehrlich's piece about the large volume of air in both of those spaces and the large amount of space, I think, provides us, even with spacing, plenty of capacity to handle the turnout of folks expected for town meeting.
Right. And I think that, if we just, again, I thought Lee's point last night of people needing the armrests was what got me thinking of 2 rooms. And then I realized 2 rooms allows for greater spacing. But even if we went with the auditorium strictly as you need it, not that you want it, but you need it, we could even consider just having people sit at the ends of the opposite ends of the middle sections. That probably would hold 40 or 50 people plus maybe, if we have every third or fourth row on the ends, we could probably fit 30 to 40 people in there, very widely spaced, and then everybody else could be widely spaced in the large gymnasium. So again, I'm not asking for answers tonight, but I think the idea of having a walkthrough and whether you want me to go with Steve sometime to the high school or whether Steve just wants to contact the schools. Again, I'm just trying to float the question so it's not a big rush and we feel we're rushed to make the right decision. I
think these questions are the right things to be asking. I think this is the right time to be asking them. I think that as far as people in the auditorium, having one person kind of go into the row from each side of the row, they could actually go in different amounts. So we could probably get our 6-foot spacing and still have a person in every row.
Oh yeah, zigzag
Yep.
them up. Yes, yeah.
Exactly. So I think that is possible, and so we can fit some people there. There could be, though, in the really bizarre case that lots of people wanted to attend a town meeting, that we hit our capacity and don't have capacity for any more. Is it possible for us to say that due to safety reasons we have to cancel a town meeting because it's oversubscribed?
Well, once the town meeting's called to order, the voters really control things. Now, if a health or safety declaration is made such that it's not safe, then I think that there would really be two options. The first option would be that I could invoke the Chapter 39, Section 10A to say there's a safety emergency and we have to recess and continue. The other thing would be is if it got to that point, the voters, I could entertain a motion to essentially adjourn to any sort of future date. So there are ways to cope with that. It's not like once we start, we have to go. If at any time something, became important enough to either, raise a motion or to come to my attention to say this can't continue.
Well, if either of the rooms became too crowded, it could become a safety issue where we would want to interrupt the meeting so that we could actually have the voters decide whether they wanted to keep going or not.
Right. Right.
Dr. Ehrlich, you were about to say something? You're on mute, though, I think.
I also saw that Alan Edinburgh, I think, had a question.
Yes.
So I'll let you decide who or ask the questions when they.
We can go Alan Edinburgh first and then Lee Emery, I guess.
Okay. If there's going to be a walkthrough of the high school, one of the things I think should be looked at is the check-in process. Normally it's done in the small lobby at the bottom of the stairs, which is a pretty tight space and can create a bottleneck.
Yeah.
I might suggest that there are two gyms, and whereas the larger of the two would be used for the meeting, if the smaller of the two were used for check-in, that would allow for a much larger check-in table to allow the staff to spread out, as well as provide more room to stand in line to check in with the 6-foot separation.
Right. Yeah, I should hasten. Obviously, Wendy's on the line as well and can chime in. But I do want to hasten to say the questions I'm raising is really the first step. There are a lot of detailed questions. On a nice weather day, we could have people wait up 6 to 8 feet apart outside, and the check-in desk could be right inside the floor where people go in, and we just let one person in at a time. And then they are expected to get, to the stairs or the elevator and go get themselves seated, and we sort of maintain spacing. Because once we decide whether it's plausible to have the meeting once people are seated, then there's all the questions about how do we safely get people to go in and go out. So when the meeting's over, if there's a safe way that people are willing to be patient and say, stay 6 to 8, 10 feet away from the person and just go out safely. So.
Yeah, if folks could go on mute and they're not talking, especially I think we had this last night too, but when folks are watching the meeting or they may be doing something else, watching the meeting simultaneously, we get a lot of feedback.
I was thinking the same thing, John, about the check-in upstairs or even the front door foyer in that area.
Yeah, just to separate people so people can get the benefits. If it's a good weather day, get in line outside. And then that way your staff would only have to handle, if you had people like 12, 15 feet apart at your tables, you could have 2 people at a time, walk up and be separated. Then they could go to both sides of the stairs and stay separated and get seated. So, but great. Thanks, Wendy.
So my question was on the alternatives, if it ends up looking like it's going to get too crowded, could we actually ask if anybody would volunteer to leave?
Yeah, well, I mean, at that point, anything is up to grabs. I mean, our role, my role as the moderator and your role as selectman is we want to encourage people to, invoke their civic duty and to be citizen legislator for the day. But just as people have the right to decide whether they want to come based on whether they have childcare, religious, or every year we have people who can't come or choose not to come. And if people, even if it wasn't a capacity, if there were people who felt that, it's this person sitting too close to me, they're welcome to leave. And we could, as I always do, I could tell people what the options are. The options are we either bring it to a vote, or if anybody feels uncomfortable and wants to leave, I just don't want, I think we're all in agreement that we want all the voters to feel that we're providing as safe an environment as we can, and that we're taking the actions we can so they can make their own decisions about how they choose to participate in town meeting or not.
And if I may, this is Shelby. I feel like if we are anticipating that we might have a great turnout and we're going to be at a place where we'd have to propose that people or ask people to leave or adjourn town meeting, then in my opinion, we're not ready to have town meeting. I mean, I think we should be prepared to what's the maximum capacity we could have safely in the however many rooms, and make a plan that aligns with that, and you know, in a date and a time in which the Board of Health feels comfortable that we can do that. But I think it's hard enough to get people to town meeting, let alone to adjourn it once it starts. So I just think that would be a disaster.
So my impression is the upper end is usually around 300 or 400 people that attend town meeting, and with the occasional town meeting that is significantly above that. Correct me if I'm wrong, John.
Yeah, I mean, Wendy keeps the numbers. I believe that at a Saturday town meeting, the first day when the budget comes up, it's usually Saturday afternoon, Saturday night is when we hit our peak. I think it's usually 150 to 200, sometimes to 225. And it's in extraordinary circumstances in terms of things like the high school lights or a large spending project that we usually go much beyond 250. I do want to mention that Brian Callahan, the principal at the high school, sent me some rough numbers that he had done today. And he thinks that with 6 foot separation on the gym floor and in the bleachers of the large gymnasium, it would hold 190 people. And I haven't actually looked at a map of the auditorium, but I've been visualizing it. I think with lots of separation, we could probably fit another 50 people or probably more in the auditorium if we did the 2-room meeting like I'm thinking we should do. So if I'll have to look at Brian's map and look at the numbers, but if we think 190 would fit in the gym, and then if we think of 50 or 60 at least fitting in the auditorium, that's pretty much close to what I think our usual normal town meeting is.
And John, if I could just add though, I think that's looking at individual, if we had 190 individuals,
Yeah.
but I'm assuming that we could, families, husbands and wives, children could sit
Right.
together.
Again, I don't know how comfortable I'd be if the boxes that we asked people to put chairs in were like exactly 6 feet, but if we spread them to 7 or 8 and told people that, you know, if you and your wife or you and your partner or you and whatever, you know, are comfortable sitting because you've been in a cohabiting, you know, environment, you know, if you've been exposed already there, then yeah, I was assuming that, you know, for instance, if I was not up on the stage, if my wife and I came, we would be comfortable sitting next to one another because we've been together, you know, this whole 10 or 12 weeks. So we probably could fit a few more in too if we just assumed that would happen for some groups.
Good. So I think that probably at this point in time, it's sounding like we think that it's feasible. We have to wait for the numbers to come in. I think that we need a separate group that's actually going to go and develop a plan to figure out how we can best fit people into the space accordingly. The rough numbers sound like they might be able to happen. If it turns out that in looking at it that we don't think that we'd be able to fit 250 people, that might mean that it's a no-go right now, and that we need either to do it outdoors or add additional space to try to accommodate that. I think that if we could only fit 200 people, we do run the risk of having it be oversubscribed and having to, you know, put people at risk by starting a meeting without proper safeguards.
Wendy, do you have the numbers at hand, or are my guesses right that it's usually about 200?
It's right. I mean, yeah, no, it's usually around 200 for the beginning, and then after,
Thank
you
you.
know, after the budget articles, it starts to beat out. But
Right.
I mean, my totals don't break it down individual nights or hours.
Yeah.
It's more
Yeah.
the total of everybody that shows. And
I
honestly,
usually,
we hardly ever go over 300 for
yeah, I
everything.
usually scan the vote total, and I think that's what it is, but I can verify that as well. So, all right. Anyway, so I don't want to take a lot more of your time, but Dr. Walsh, if you want to, I mean, obviously, I'll help out on this group. I don't know if one of you and any of the selectmen, or if you want to have Steve do an initial walkthrough, but just let me know, and I'll be involved, you know, however I can.
Yeah, so I'd like to be involved. I'll have Steve and you and I. I'm actually pretty good about space packing and you know, optimization. So I'll work with you guys on that.
And when
so I don't think we have anything else.
Her staff, she should be involved too. So
Okay,
Nathan.
excellent. Yes,
Nathan.
Syed.
So one of the things, and John, you may remember Leah Talbot had suggested
Oh,
the
yeah.
idea of reservations and everything. Do you still want it? I hope you'll be considering that. I think it's a great idea.
yeah. Yeah, let me just mention, one of the things we're thinking, especially for elderly or people who might need the armrests and the chairs, Leah Talbot last night had the idea that as we get closer, maybe next week we could decide, would be to use the COVID-19 line for people to declare their intention that they're planning to attend town meeting, and if they think they would need the accommodation of the armrests and the softer seats for either age or medical reasons. That would also give us a way of judging before that Saturday of how many people we think are going to show up. Obviously, it wouldn't be a commitment, and it would not be a you have to do it, but it might give us some sense of the anticipated turnout.
Yeah, we'd certainly
One
I think
other thing,
probably
Nathan.
give a better estimate of the lower bound, not the upper bound.
I think too, if once people know there's a reduced number of articles, you know, they may not choose to come. I you know, if they know it's just the things that we really feel need to get done right away, we may not, they may say, oh, I'll just wait until fall or whenever we're going to do it again. I don't know, just my thought.
Yeah.
And Nathan, one other thing for the board to consider as I mean, I know this is, and this is also applies to John, is that we really do need to make sure that we communicate like whatever our position on the risk, because I think the residents are looking for us for leadership in communicating that risk. I think it's incumbent on us to do that. Here, you know, these are the precautions that we have put. This is what we think. I think it's important that we communicate that to our residents so that they make an informed decision about attending the town meeting.
Yeah, I mean, I think with all of these things, our goal with having a town meeting is not to have people spread COVID-19 in a way that is any different than when we have a town meeting and we might have the normal expectation of risk. I mean, we have a town meeting when flu season is in session and our elderly are, you know, at risk of getting flu. Now with flu, we do have vaccinations and they sometimes work, they sometimes don't work that well. But, you know, there is always inherent risk when you are interacting with people. What we want to try to do is try to keep that risk as low as possible. But we're not, the goal is not to have zero risk. The goal is to have it be a reasonable, manageable risk that is not, you know, the point where it will, you know, cause large problems for people. I don't want anyone to get sick, and I want to have that risk be low enough so that I don't have the expectation that anyone will get sick because of town meeting. But there will always be a risk. I don't think we can eliminate all risk. So, I mean, you could put it in terms of numbers, but I don't think that our estimates of the risk, you know, are going to be accurate enough to be worth giving actual numbers for.
So, Dr. Walsh, I know that John had said he wasn't looking for a vote tonight, was bringing this up. Will this be something we put on next Tuesday's agenda for potentially a vote then about moving ahead? I guess, will that give enough time for the folks that need to go to the high school and look at the spacing to get that work done?
So my thoughts are that we should have the group go look at the high school before next week and start this process of figuring out whether the space looks reasonable and whether we can count the number of bodies that they can fit in there. As far as a vote for whether we think that we can have it, I think at this point the Board of Health is, and correct me if I'm wrong, other members, but we think that it's feasible, and that we want to wait and see as we get closer whether we still think that's the case. As far as advertising it and doing that, I think you have to at some point say that yes, with the current trajectory, we can go ahead, and that we want to start making plans and start making commitments with the expectation that there is a chance that we will, revoke that and say that no, we don't think it's advisable to go ahead with it.
Yeah, I think that's fine. I think the reason looking for a date sooner or later is exactly what you said, knowing the fact that it may be canceled any time, but there is a lot of work and logistics that need to get set up to move this forward. Both logistics with Wendy and the town side. There's the finance committee to consider with their booklet, the selectmen in terms of voting and doing final votes on articles. So we need a little bit of time. It can't be that we wait until the 19th and say, okay, yep, we're to go, and now I'm going to get ready and be ready for the 20th. And I know John said the 13th, but I'm thinking of our regularly scheduled meeting. I think it would be great if we feel, it sounds like we're moving in the direction that we feel if there's certain things we can do, and if we can get to those over the next week, I think it would be great for all of us in the town to know that we are moving forward even by next Tuesday for our regularly scheduled meeting. After that meeting, for folks to be preparing, again, with the knowledge that it can change at any time.
So I think I'm understanding what you're saying, and what I'm trying to get across is that right now the numbers are in the direction that, at least me personally, I'm comfortable having it be held on June 20th. But if we, even on the week of before the meeting, between the 13th and the 20th, if the number of cases in Westborough is spiking and it's, we're hitting a peak that we've never seen before, that regardless of how much preparation, booklets you've put together and that sort of thing, I would still be recommending at that point that we don't have a town meeting in light of all of that spiking. So
Absolutely. That's absolutely. But
it's like a moving consensus of the room. It's like at this moment in time, this is what we think. But as they said,
Dr. Hashmi or Dr. Ehrlich, I don't know if you want to come out and weigh your thoughts on, whether this is seeming likely that we would be able to have the 20th based on the current numbers that we have, or whether, you want to take a more conservative approach.
I just would like to see, I know so Ian, we're meeting on the 9th, right? The meeting after that is the 16th?
16th, which is
4
5
days
days before. Yeah.
The thing is, so a couple of things. By the 16th, we will know whether there's been potentially increased transmission. That is, if people, the asymptomatic people or whatever get tested. I think. Sorry, I'm just trying to mull this over. It's just, John, when can you cancel the meeting? I'm just curious.
I really can't cancel it till the 20th again, unilaterally. I mean, I'm supposed to. I guess I could do it at any time, but I could do, if it turns out that there's bad news, then I can do what I've done before, which is to say, yes, we postponed it till then, but it looks like it's not going to happen. Again, for me, the important thing is warning the town and the staff and everybody who prepares to say, do we think we're going to have it or not? And then, we can cancel anytime up until it starts.
Okay, then I guess I'm fine. I'm fine with us moving and then reassessing, looking at our numbers on the 9th and on the 16th. But I really strongly
I think we can reassess up until 11:59 on the.
Right. Sorry. Right. And I think but I do feel that we need to communicate with the residents throughout this, entire process that, you know, and I think you said it, I think, Nathan, you said it best. I mean, the risk will not be, it will not be eliminated, but the risk will be present. And we will do our best to mitigate it as best we can, you know, opening the gym and whatever else we can do to bring fresh air.
Dr. Ehrlich?
So, yes. So with respect to, do I think it's likely we're going to have it on the 20th or not? I would defer making an assessment. My feeling is that the 20th is a reasonable target to shoot for, but I would like to plan to have some type of endorsement vote, what have you, at the next meeting. And in order to have that be an informed choice, I think we need several things. One is you and the others who will go to the gym and the auditorium, you'll have a projection for what you think is a reasonable capacity for those venues. I would like at that time while you're there to at least consider a third venue that might be audio only for overflow if need be, just so we know, what is the surge capacity that we would have if it came to that. So that's one thing I'd want to know. John, I appreciate you wanting sort of to keep it high level tonight, and I think that was entirely appropriate. But I think at the next meeting, we need a list of the sort of detailed questions and what are the problems and what are the proposed solutions to overcome them. Queuing up to get in is certainly one of them. We identified microphones. I will raise a third one, which is that at the end of town meeting and everyone gets up to leave, it's your highest likelihood of lack of social distancing. And sometimes you might need to have people exit by row or something to that effect, the way you've seen in other situations. So if you and others, John, can almost develop a bunch of FAQs for what are the problems that need addressing and what is the proposed solution, so that we can have a comprehensive plan presented at the next meeting, then I think if there aren't insurmountable obstacles and you guys have demonstrated capacity as being appropriate, then I think proceeding for the 20th would be reasonable, assuming not a spike in numbers. And I had thought of this as well, but I saw from Lee issues around the bathrooms. Those are very high touch contact areas, doors, faucets, and things like that. And a strategy for dealing with that would certainly be in order. So,
the other two minor points that I think that we should add to that list are things like childcare, that's an option, and who are going to be the runners, and are they going to be available to do this? I think, Lee, you're on mute, so we can't hear you if you're talking.
Yeah, I've been going under the assumption that since most normal childcare is not been allowed to reopen, that we would probably not have childcare. So that came up last night as well. So I just don't see how you could. Childcare would have to be so one-on-one that it would be with a stranger, and it just seems I don't think it's ever been used to a great extent, and we would just have to publicize that by no surprise we would probably not be offering it. But yes, I will go through. I mean, I know Wendy has a list. I have a list. I know there's guidelines that have been being developed by moderators, and I know Wendy's got ideas from the clerk. So we'll try to come up with something and get something circulated in time for next Tuesday's meeting, and obviously send it out early if we can, so people can think about it.
Good. So I'd like to move from town meeting then, if there's nothing further, and pick up one of the other issues that we have.
Thank you, everybody. I appreciate it.
Thank you, John.
Thanks, Wendy, too.
Does anyone have a preference what we tackle next? I think otherwise we might go to the restaurants.
Sounds good.
So I think that one of the things that's happening as we go into phase 2, which there's no date for yet, but restaurants are looking at trying to have outdoor seating and trying to figure out how that fits into the plan. There might be other aspects of the restaurants that we need to discuss as well. Steve, I don't know if you want to just take a couple seconds and introduce what you kind of thought we needed to talk about.
Sure. So, in the next few weeks, we expect that as we get into phase 2, there'll be an announcement about allowing outdoor seating for restaurants. The state has given us guidelines, at least from the public health side of it, as far as how this should look with separation of tables and that sort of thing. But I think what we're focusing on a little bit tonight, and why Fred is here and why we need to talk to the selectmen about, is where are these going to be? Are they going to take up parking? Are they going to take up, where on the property will these, new outdoor spaces be put? What are the criteria for where they can be? Safety precautions and all, alcohol, all that sort of thing. So Fred Leonardo from the building department, he is here, and we did develop a kind of a checklist plan for restaurants. Kind of wanted to go over that with the selectmen, with the Board of Health tonight.
So can I just add that the selectmen under the governor's order has to develop a process, and so that's something that we're going to ask the Board of Selectmen to vote on tonight. I did send something out to the Board of Selectmen earlier this afternoon, and we'll talk about what that process is. But I also have a written procedure that we'd like you to vote on that I just sent out because I just got it. And so if you want to take a look at that, but basically it would give the building commissioner approval authority over this process.
So do we want to go to the, Steve, to the building personnel to discuss what's in front of us, or?
Yep. Fred, do you want to discuss that at all, or has everyone seen the outdoor seating, the draft of the plan that Fred submitted that Christy sent out earlier?
The board received several documents, but Christy just referenced one that was just sent, which I don't know if we saw or not. So.
Yeah, so I'm gonna, if it's okay, I'm gonna share my screen so that everyone can see it. But basically, and Steve, you can, and Fred can provide detail, but the state has outlined very specific guidelines in terms of what the restaurants need to do. And then they've also, in the governor's order, have given waivers related to zoning and site plan, and even an amended process with the ABCC in terms of liquor licensing. And so if the selectmen approve this process, which I think I'll let Fred and Steve speak to now, what that's going to look like. But what we've tried to set up is a very expedited approval process, so that when the governor announces the date for phase 2, restaurants can be ready to open. So I don't know, Fred and Steve, do you want to just talk about? I actually did not send the documents, I don't think, to the Board of Health. I just sent them to the Board of Selectmen, so I apologize. But I will share my screen after Fred explains the process so everyone can see the policy that we're setting up.
So it's Fred Leonardo, building commissioner, speaking now. What our intent is to do an expedited permitting process, as Christy and Steve have alluded to. I chose what we now refer to under our electronic permitting through Permit Pro as temporary structures. We've actually had the software company add and/or uses to the title. That was just updated this afternoon. So what would happen is a restaurant would apply for that permit through that process. They would then, there's an additional sheet they would ask a series of questions, which would go into, where you're going to locate the use, how many tables, how many chairs. There's a variety of questions to that regard that would be identified in the application. We would have Steve or anybody else on the Board of Health sign off, myself sign off, fire department sign off, and police department sign off. Somewhere in there will include the approval of the select board or whoever for the ABCC stuff, and Christy can talk to that. And that'd be it. It'd be we'd try to abbreviate the process. We realized we'd have to turn them over in a matter of a couple days. I haven't specifically talked to fire yet, but the presumption would be that probably myself and/or fire would go out, just check the site once it was set up and allowed to open. just to make sure that there's some kind of barrier between the parking area or whatever, and those types of things. So we're going to try to utilize everything that's in place. We'd reference that it's only a temporary thing. The governor's order actually gets into the date that the temporary use would be allowed and things like that. So we just briefly referenced that in the application. The application would include a section for owner authorization, because the applicant would have to have authorization from the property owner. There'd be a section for that would be it, actually, and then the board has to decide if there's going to be an attached fee with this as well tonight, hopefully. And that's kind of a brief rundown of what you got.
So I'll share my screen now. Basically, this would be the approval of the process. So the governor's order says that the Board of Selectmen sets up a process. So it's very brief, but it just basically says that we would apply to the building department on a form provided by the town, which Fred just talked about, the application, and that it would include the proposed layout. And this is all just consistent with the governor's order. So this is, just to allow us to have like I said, an expedited process to move this forward. In terms of ABCC, typically when there's an alteration of premises, the ABCC has an approval function in that process, which takes time. And so the governor's order actually removes that and allows the local licensing authority to approve the alteration of premises and the restaurant to move forward with the outdoor seating. And then we just submit the information to the ABCC. And so it creates an expedited process. And so right now we're considering with town council whether or not the way the language is written, if that's something that the board could delegate to the town manager, or if that's something that the board would need to hold some regular meetings in order to vote their own approval. But sort of as a precaution, we posted a meeting on Thursday at 5 p.m. In anticipation of people being prepared, or restaurants being prepared to apply to the board, so that we can really move this forward. And then I guess I would add that this, the guidance allows the restaurants to create additional seating on their property. One of the pieces that Fred would have with the application is approval by the owner of the property for this. And if someone were looking to put seating on a public way, a parking, potentially a parking space or the sidewalk, that's something that would need to come before the Board of Selectmen for their approval. But as of now, in terms of the restaurants that we've heard from, we have not had any requests at this point for that.
Yeah, the only thing I'll add to that, Christy, is that not Central House, the one at 22 South Street, I think, it started to talk about that. I don't know that they wouldn't have to suck up public parking. I don't know if the select board would be in favor of that or not.
So yeah, so we would
Central House?
We would just
Central House? Central
Yeah.
House?
No, South Street Diner, right?
Yes, thank you.
so we
Central
would,
House actually has a little bit of parking.
we would just need to see what the plan is, and then they would just bring it before the board for your approval.
Right.
Yeah, and Fred, just to be clear too, this is those restaurants that already have outdoor seating. It's already been approved in their permits. They've been operating them. Now they'll have to operate with the guidelines of distancing, whatever, but they do not need to go through this process. These would be for those that either currently don't have it or those that have it that wanted to expand it, I guess. Is that accurate?
100%.
Thank you.
I know that this is going to be an issue for the Board of Selectmen, but Steve, is there any health issues that you can think of in terms of some of these places providing table service that we need to be aware of, or do you think that that's not a problem?
No, I think we can handle it. I mean, unless there's something really out of whack, but we'll be reviewing, the plans with Fred as they come in and, for that stuff. So I can never say never, but I would guess that most places could probably comply with what we need them to.
And are you going to have to go and inspect before they're allowed to do it, to actually see how they're physically laid out, not just the plan, but to actually inspect, or not?
No, well, the state has told us no, that, we would respond to complaints, but as
Okay.
going around and pre-inspecting all of them, we would generally not do that. We just look at the plan. If there are any real, problems with the plan, we'd make comments at that time. But after that, we would just respond to complaints as needed. Unless we were out there for a regular inspection, then we might, take a look while we're there.
Steve, may I ask you a question? I just wanted to clarify Ian's question. So Ted's Montana Grill and Tavolino, if they open up again, are two ones that come to mind right away. They already provide outdoor dining, but the outdoor dining they provide right now, or have been providing in the past, wouldn't quite meet the COVID standards because of spacing and stuff. So wouldn't they also have to have some kind of review?
Well, yeah, we would. Well, that's a good point. Obviously, they'd have to remove tables to meet the spacing part, and I guess we'll have to talk about whether we go around to those facilities that already have outdoor seating, just make sure they're complying with the space. But there wouldn't be a problem with, it's already approved, so it would just be a matter of removing tables. So
Yeah, and Lita, my question was really whether they needed to go through this new process, which they would not have to pull a new permit. They would not have to go through the selectmen for liquor approval because it's already approved in the premise. However, take the two you talked about. If they decided that they wanted to expand on those already outdoor seatings, Ted's, for example, I know it's relatively small, but they decided they wanted to try to go out further or whatever, then that would have to go through this process because that would be an alteration of premises that would need to be approved through this process.
Right. Not to jump in on that, but actually somebody, I think Steve or somebody mentioned this yesterday or today. Not Your Average Joe is actually a great example. They have a very limited amount of outdoor seating. So it's likely they may want to expand out into the parking lot, in which case they would have to apply for this permit.
Great. Thanks, Fred.
Hey,
Ian, do you want to take a vote on this, or are we just discussing this tonight?
I'm ready to make a motion,
Well,
and then we can have further discussion.
Sure.
I move that I've got to get the wording of the policy. Hold on.
The restaurant outdoor seating application procedure and responsibility.
I move that we approve the restaurant outdoor seating application procedure in response to COVID-19 as presented, and further that we waive permitting fees.
Is there a second from the board?
I'll second that. Shelby.
Selectman Marshall. Okay, now let's open it up for discussion. I know, Dr. Ehrlich, we cut you off there, so please go ahead.
I just wanted, because you were starting to make the motion, Alan, and the issue of fees had not come up, I just wanted to make sure that would be addressed. I support the motion as it was made because for two reasons. One, all of these facilities are already paying fees on a yearly basis for to be places that can serve food and whatnot. And then secondly, all of these places are hurting economically because of the impact that the COVID-19 has had. So waiving them seems to be an appropriate thing for the town to be doing, in my opinion. Obviously, it's up to you all to decide.
Thank you, Dr. Ehrlich. Thank you, Alan, for that in your motion too. I think that was appropriate. Further discussion, and again, just to remind, this was just a Board of Selectmen vote, but we appreciate comments from all here.
I just would like to remind, I think we just need to make sure that we message it to the residents. It goes back to personal responsibility that, I guess you know what I'm saying, that, just be careful.
Yep.
And respect other people.
One other clarification I probably should have mentioned before, and I apologize for this. At least one restaurant has already approached us too about a tent. That would also be an application similar to what we're going to do for this. I hadn't anticipated waiving the fees for a tent under this. I'm assuming that'd be okay unless the board feels otherwise.
I would think it would be waived
Yes.
as part of this temporary allowance.
Right.
Yeah,
I would.
I'm comfortable. The fees we collect aren't going to make a material difference to the town budget, and these are businesses that, you know, have been struggling. So anything we can do to make it easier for them to recover, I think benefits them. It benefits the town. It benefits our residents.
Fred, is
Okay,
that
so-
okay with you?
I'm sorry, I was going to just ask if you can make a second motion at some point that any tents related to this, or restaurant tents, or however you want to state it, you're also waive the fee for that.
Alan, can you add that to your motion?
Yep. So the motion I would add, and further that the town waive any fees related to tents or other temporary structures being put in place as part of this program.
And Shelby, you okay with that? With your second?
Second, sorry, yes.
Okay, other comment?
Yeah. I guess I'm wondering at what point the board, I'm a little unclear with decisions and guidance regarding use of parking spaces, that sort of thing. I mean, I'm looking at the documents that Christy provided to us earlier in terms of, you know, fire safety measures, that sort of thing. But is this going to come back before us for further discussion, or are we, will Fred be making these decisions? I guess I'm just a little unclear.
Yeah, Fred would be, the way that the procedure is written, Fred would be making the decision, and this is so that restaurants aren't having to wait 48 hours for a posting for a meeting.
So
the site plan and all of the zoning regulations are actually waived under the governor's order, and not the policy, but the governor's order. And so Fred would just work with the individual businesses if they were taking up parking spots on their own property. But if you mean parking spots that are town property, then that will come back to the board. If it's in a public way, it has to come back to the Board of Selectmen.
Okay.
On an individual basis. Sorry.
Okay, thank you. So, and so we'll use the example we already has been shared. So in the Bay State Commons area, that's considered private property. And so if there's an arrangement made with the landlord, let's say for outdoor seating to use some number of spaces, and they can cordon it off, and that ultimately wouldn't have to come back to the board, but Fred would ensure safety and fire and all of that under his review.
Yes.
Correct.
Okay, thank you.
And let me just add to that too. Great question. So that's why we had the approval by fire and police too. So we'll review this again tomorrow afternoon. We already have a meeting set up with those departments, but they would obviously be giving advice to whether they agreed with the arrangement or not. So it wouldn't just be solely me, but it would be fire and police as well.
Okay. The other, I did not see so something to consider with what additional signage would be permitted under this. That's not part of this. That might be directional for safety purposes, or just, you know, well, and enter here, or don't go there, or whatever. So we may, you know, that might be something that we need to further clarify as temporary again.
Well, so signage, I've kind of been.
I know it's our favorite subject. We love signs.
Yeah, it really is. Thank you. But you've noticed that the craziness of the signs has kind of gone away, but there's still a little bit when you go down East Main Street a little bit. We're open for business, that type of stuff. So the smaller signs, I've kind of tried to ignore. The any directional signs they can do by right anyway.
Okay.
So if it's like bathrooms are this way, things like that, as long as it's encompassed as part of this procedure, I don't really see a problem with that. As long as they don't put up big banners, you know, that we're now open on the main street, then it shouldn't be a real issue, I don't think.
Okay.
And Fred, how will they deal with the issues of bathroom use?
Well, so that's a great question. Again, Steve and I talked about that briefly. One of the questions we have on the application, if you will, is how are you going to be able to allow customers to the bathroom? So I think some of that's going to be complaint driven too, but maybe Steve will want to weigh in on that.
So we did ask for lack of a better word, a bathroom plan when they submit the application, how they're gonna, keep people from congregating, that sort of thing. So it really depends upon the facility. If you had a place with a big bathroom, maybe they, certain toilets, they don't let people, to space people out while they're in the, I guess people would just have to be somewhat, it's really facility dependent. So but that is something we'll review. And if they need to put markings down or whatever, we'll have to kind of work our way through that. I think it's a learning process for us too.
Sure.
And a lot of restaurants have individual use bathrooms.
Some do, some don't.
So we'll see.
Well, I'll give you two extremes. If you look at Harry's, and they're one of the ones that came to us first, you don't really have much choice. It's a one-stall shopping there, and there's only a couple stalls altogether. If you look at a Toro's, they have a couple different areas of bathrooms. They could space different people different ways. They have quite a few stalls. So the restaurants go both gambits. We have both throughout town, as you all well know.
One thing that I did see, this is Shelby, on the plan was that the restaurants are supposed to provide details on how staff and customers will be able to stay 6 feet apart while waiting on a table, etc. So that part I'm maybe less concerned about, but it includes in the kitchen and staff rooms. I haven't been through too many commercial kitchens lately, but the ones that I grew up in, there's no way they're 6 feet apart. And they're not 6 feet apart right now if they're preparing takeout food. So I would be concerned with having that in there and the ability to comply.
I see your point. I think we're just asking people to do the best they can.
Yeah, no, I know. I just, again, if it's in something and then the public says, well, they were both standing at the cash register. I mean, I think the intent here is to, protect the public. My personal impression is that these individuals have been, in many cases, working together to deliver takeout services for a while, albeit in a, larger space with fewer people in it. So I would just maybe consider maybe rewording that or taking a look at that, how it applies to staff versus customers.
Okay. Will do. Point taken.
Great. Any other comments from the board?
I just wanted to thank Erin for this because she was the real spearhead on finding the plan. We tweaked it a little bit, but the majority of what's there was what she found. So I think Fred would agree with that. She took the initiative on that one. So anyways.
So absolutely. Thank you, Erin, very much. And
yep. We were all clapping.
Yeah. And I think I'll take the vote first and then a comment here. But so roll call vote for the board based on the motion by Selectman Edinburgh and seconded by Selectman Marshall. So Selectman Edinburgh.
Edinburgh, yes.
Selectman Marshall.
Sorry,
Emery, yes.
Marshall, yes. Sorry,
Marshall,
on
yes.
mute.
Selectman Emery, yes. Selectman Ashman.
Yes.
And Selectman Johnson, yes. So unanimous vote, 5-0. Thank you very much to Erin, as you said, but really to all the town staff that's worked on this and did it quickly. I know as board members, we get calls, restaurant owners, others have said that they're looking to stay afloat here and they're trying to do the best they can. And I think, while not optimal for them, they're looking at this as an opportunity to make things work. And likewise, while not optimal for town staff to have to do this and to do things quickly, it doesn't go unnoticed by us as a board. We thank you for jumping on this right away and appreciate it. And I think the restaurant owners and restaurant patrons and residents will appreciate it as well. So thank you. Dr. Walsh, back to you.
Excellent. So I think next I'd like to tack up some of the stuff the rec department is doing, including the beach and other things, the recreational camps that they typically offer. And so, Steve, do you want to give a quick intro to this topic?
Well, sure. Well, Jen Kirkland is here from Director of the Rec Department, so I'll kind of just turn it over to her, I guess, to kind of explain what's going on.
Hi, everyone. So last week, the Rec Commission met and voted to cancel most of our playground programs and sports programs that we typically offer through the end of July, with the caveat that we try to offer as much as we can, one-off events or activities, keeping programs maybe like golf that are typically individual sports anyway. They really felt strongly that we kind of don't leave the town of Westborough, in limbo all summer with nothing for their kids to do, and which I totally agree with. So, so basically we're canceling our traditional summer programming, almost all of it, through July. Come August, we will kind of reevaluate things and see if we can run any kind of mini programs, maybe, sports clinics or things like that. But for the month of June and July, we are gonna cancel all of our traditional programs. And as far as the beach goes, they also voted to keep the beach closed for the summer. These decisions definitely weren't made lightly. We understand that people love the beach and that it is a resource for people in town, but it just looking at the guidelines, and just looking at the what we would have to do, we would need more lifeguards, but be able to sell less passes. That was just going to be a huge undertaking. Plus the re-education of the town. They've, for years and years, it's been, you can walk up to the gate, buy a day pass. Now we'd have to be turning, people away. And yeah, tennis courts are open. Sorry, that just popped up on my screen. So yeah, Lee had asked if tennis courts were open. They are. So again, just back to the beach, it was going to be a huge undertaking that we just didn't feel that we could do it safely and do it the right way. But yeah, so while the beach is closed, while we're closing most of our programs, there are other means of recreation that are open. The tennis courts and pickleball courts are open. That, to my knowledge, I don't know if Steve has a different story, but has been going well. I haven't heard any complaints. I believe playgrounds are due to open in phase 3. Trails are open and have been. And I believe, state parks, I haven't heard of those places closing. So places like Hopkinton or Ashland or Cochituate are places that people could go and swim and be outside. And just something else to note, I was on calls over the last 2 weeks with many of our neighboring towns, and almost everyone is doing the exact same thing. If they have a beach, they're closing it. Their playground programs, their sports clinics, they're all canceled. So we're all sort of doing the same thing. So I just wanted to bring that before you. I haven't sent anything out to parents yet. I'm planning to do that tomorrow, but I wanted to bring it before you guys first. And yeah, so I'm happy to answer any questions, feedback.
So if you can just remind me, when the beach is closed, do we typically put a lock on it and not let anyone there? Is that considered people trespassing if they're there? Or is it just that we don't have a lifeguard and that we don't take responsibility for it? What is the status of the beach per se if it's not officially open for the summer?
So the gate is locked. And there are signs that say no lifeguards, the beach is closed. But that said, if you've driven by the beach, even just last week, you can walk around the fence. I don't know if we've ever gotten into the terminology of that it's trespassing. In my 6 years, we haven't, ever called the police on anyone that's been there. So I don't know if Christy could chime in, or if that is trespassing. I really don't know. Sorry.
Yeah, no, that's okay. So actually Kim followed up with our insurance company on this, and basically the beach is posted no lifeguard on duty. If we could post it no trespassing, please take notice, but we have never done that, and we're not recommending that at this time.
Okay,
I did see a question that came through on boat ramps, and I believe the boat ramps are state controlled, not town controlled. Is that correct?
They are. They're state owned. Yes.
Jen, this is Shelby. Oh, sorry.
Stuff or not, but things like fishing derbies or hunting and activities like that. I don't know if any of that is through the rec department or that's other groups that run that, but is that still going to be going on? And how do we have controls on those sorts of things?
So we run a program, it's called Outdoor Adventure. I talked to the instructor today. He is a little nervous, but he thinks he can do it. But it's a, fishing, they hike. It would just be, a complete overhaul of his program, even though you're outside. It's just the social distancing aspect has him a little bit worried, but we typically don't run that till the end of July anyway. But I would hope that we could still run that. And yeah, that would be stuff we would be thinking of, like a 1-day fishing clinic. The state usually runs a program for us. So we'll be looking at all kinds of things like that.
Good.
We talked to the rec department when they were trying to work through what made the most sense for the summer, and certainly like Jen said, they're talking about sort of one-off events instead of their regular weekly programming, and those sorts of things. I think we haven't figured out exactly what those look like, and can use this meeting and the expertise of the health department to make sure that we're doing things in line with all the guidelines.
I mean, at this point, it doesn't sound like you're asking us for anything because you're taking the very conservative approach of closing stuff. Had you asked that there might be stuff that, we thought that might be safe to do, but if it's not practical to do, then that's a different issue. And so I recognize that closing these activities and the beach is something that you've put a lot of thought into, and I don't want to, have you reevaluate that. But if you did, just bear in mind that is the more conservative approach that you've taken.
But it's also in line with, like Jen said, it certainly wasn't taken lightly, and it's in line with what our neighbors are doing. I think we have to keep in mind sort of what the social distancing with kids would look like. I know that my own kids forget all the time about social distancing, regardless of how much we talk about it. And so, managing that with a group of children and
Christy, you're frozen.
Actually, Christy, it's pretty easy. You cut off broomsticks so they're 6 feet long, and you attach them to little belts, and you put them on each kid's belt.
And the camp guidelines also just came out yesterday, which was a lot of people were pretty discouraged about that. We were hoping for middle of May. Not that I'm not saying that would have changed anything, but I did briefly read through them, and it's long, and the sanitizing. You wouldn't even be able to play a game of kickball, it sounds like. So it's so there's just so many layers to it. Once you get into it, it's like, what would the kids be doing? And just to keep the staff safe, keeping kids safe. What happens if one kid gets it? There's just a whole rabbit hole we could go down. So it stinks, but like I said, I think in the end, it's probably the right thing for us.
Yeah.
Can I ask a couple questions?
Yeah.
So first question, are the buoys out in, where it typically ropes off swimming area?
No, that would be we typically don't when you open the beach. Yeah.
Okay, thanks. So Jen, I can only imagine how difficult it was to, take the vote. I mean, I'll be honest, I'm pretty disappointed, but I know it was done thoughtfully. I think, I'm not sure how we align a decision to close the beach with the allowance to, at some point in the future, I know Ray has been on, I almost said this show, these meetings, to, talk about community pools opening, and, or, fitness pools opening or whatever, organizations opening their pools. So I'm not sure how those two align. I'd have to think a little bit more about that. I almost feel like the beach is a safer place, but I recognize it's also town versus, maybe a private organization doing it. And that may come with some other challenges or benefits. But I think that's a tough one. And I do think we have to be realistic that there are going to be people using the beach at their own risk. I think it's just important that we have it marked that there are no lifeguards, that it's very clear so that we limit the liability. I agree with what, Christy already provided as a way to minimize the risk. But it's a tough one.
So if there's no other comments, then maybe we can move on. I just want to give anyone a last opportunity to ask questions about the rec department. Seeing nothing, I think the last thing on my agenda was trying to ask questions about how we're going to deal with kind of the tax work that people, sorry, the elderly that are working to kind of, I forget the exact terminology, but deal with
Senior tax work-off.
Senior tax work-off. Thank you. I'm stumbling over my words here. And so we basically are just trying to decide whether we think that's a good program to go on, whether we need to have that stop, or whether it's kind of a case-by-case basis. And so I kind of wanted to open that up for people to kind of comment on.
Well, I'll just start if that's okay. So I got an email from John Steinberg, who's the chief assessor, who kind of I guess is very heavily involved in running the program. And I guess there's there's some offices that want to have senior workers back to do work, but it's a matter of first of all, we're supposed to be social distancing in our offices. So if you bring another body in there, a lot of the offices are small to begin with. Now you got one more body in there that makes it even tougher to social distance. Plus you're bringing back, it's no secret, the most at-risk population as far as transmission, and the ones that have the highest risk of having complications if they get COVID. And at some point, if we do open town hall, if these people are there, now you're exposing them to more of the public coming in. So I think it was just a question of, there are some jobs that that senior helpers could probably do where maybe they're by themselves if they're doing outdoor work, like in the cemetery, or be able to do work, maybe at their houses, things like that. But I guess the question was, even if they're willing to come into the office and the office wants them there, is that something that we want to be doing, as far as acceptable risk and that sort of thing? So that was kind of the underlying thought of why to have this discussion on how the two boards feel about, that type of thing.
I would think it would be a pretty reasonable case-by-case basis. The woman that sits in the front hall of town hall, she's going to have an awful lot of people go by her, all day long. That's probably not such a good place. But Wendy used to have someone in the clerk's office. She sat over by the window. She had a table all of her own, and she was doing some kind of, sorting or something for Wendy. That seems like that might be okay, but I think you'd have to take it case by case.
Yeah, so I think that's my leaning as well, is that a case-by-case approach seems like it might make the most sense. So instead of kind of coming out and saying that we want to cancel the whole process, that we can allow it to go on. I do think that obviously the disadvantage of canceling the entire senior work-off is that those people that want to work, that would benefit by having that write-off, would not be able to if we were to cancel it, and there might be some places where they could do it safely.
Christy, didn't we decide that for a certain period we would pay them even though they couldn't come because it wasn't their fault?
The board had that discussion at your March 12th meeting when we originally paused the program, but there's no mechanism. This has come up multiple times on calls I've been on, and there's no mechanism under the state law to do that. And we can't do that. And I know it's something that towns have brought up. And so it's possible that there's consideration for that, but it's not something at this point that has been addressed at the state level. So we can't. But I just want to be clear that we actually have brought in some senior work-off volunteers who have been helping us distribute masks, and that was part of the conversation when we talked about our process for distributing masks. So, if it's a case by case, I think that makes a lot of sense as long as we're comfortable. I don't think that, I think it would be easier for us to, work with the health department staff to determine on a case by case instead of necessarily coming back to this meeting with every opportunity for the program.
I would agree. I think we are transitioning from an emergency, maintaining health services, which would be something like distributing masks and that sort of thing, to a process where we're looking at, I think July 1st, municipal buildings all start to fall under the 25% capacity rules. And so we want to make sure that we don't hit any of the, go over any of the 25% capacities. There are still exemptions, I think, for public safety and for, things that are, to maintain the health departments and stuff like that. So there are areas where, we don't have to follow those guidelines. But for some of these senior work off, they may fall under that 25% limit that we have to worry about.
Yeah, so I just want to clarify, because I think Syed brought this up when we first got on the call. July 1st is the date for the essential functions coming into compliance. So in addition to public safety, it has been Board of Health. Other essential functions that we have going on right now is obviously the town clerk's office in preparation of town meeting, the Department of Public Works. So I just want to put out there now, when we're drafting a public communication, but the town hall staff will be brought back into the buildings on an alternating basis, effective Monday, June 8th. And that'll be for the regular hours. So even though we've continued to answer the phone during all of the regular hours, I just want people to know that we'll be coming back to the buildings, observing the reduction in rule. So with social distancing and masks, we actually have Dr. Ehrlich is helping us do all the mandatory training for our staff later this week.
Thank you. For our July, Dr. Ehrlich, you want to go ahead?
It's a quick question for Steve. Is it possible that, because we're going to have an ongoing need for this, contact tracing could be they could be, people in the program could be trained to participate in that? Would that be an acceptable activity?
Well, there are confidentiality issues there. If we could get around that, yeah, we probably could. That's my major concern.
Sure.
I think that sometime before July 1st, the Board of Health may have to deem certain functions as essential, and therefore can not, be excluded from some of the exemptions. And maybe we don't have to officially do it, but I was under the impression that we might have to do that. So that might be something for our next full board meeting in June. Good. I don't have anything else on my agenda. Is there anything else that we need to address before this joint meeting of the Board of Health and Board of Selectmen?
I just wanted to raise the thing, and I don't know if we had talked about I guess we can talk about it. It's part of the COVID response. We had talked about some sort of mourning mechanism to allow the town to mourn, flags being. I don't know if that is that still in the works or.
Yeah, so that actually went to the task force as discussed by the Board of Selectmen, and we announced on Code Red I guess we didn't. We will announce on Code Red that we'll be observing a moment of silence on June 14th with a bell ringing. So we've coordinated with the houses of worship that have bells. Also, the town hall will have a bell ringing at 4:30 on June 14th. A full minute of bell ringing, a minute moment of silence, and then another minute of bell ringing.
Thank you, Christy.
Yep.
Nice. Well, I wish everyone that, we stay safe. Hopefully Westborough, maintains nice community relations. I know there's a lot going on in the world right now, but I hope that things here stay, relatively calm, and that we can deal with one major issue like a pandemic at a time. So I'd like to entertain a motion that we close the Board of Health meeting at least.
So moved.
Do we have a second?
Oh, yes, Sayed Hashmi, second.
So we'll do a roll call vote. Dr. Hashmi,
Yes.
Dr. Ehrlich,
Yes.
Dr. Walsh. Yes.
Great, I'm going to go to the Board of Selectmen too, and just echo Chairman Walsh's remarks there. Is, you know, be kind, folks out there. Be kind, residents. Maintain social distance. The weather's getting nice. People want to get out. People are getting a little stir crazy, but maintain social distancing. Wear masks as appropriate and as defined. Treat others respectfully. We'll get through this together. We are getting through this together. A meeting like this, where we're talking about, you know, opening some restaurants, things. It's an indication that you know, the reopening is happening. Things are getting back to a new normal, as the new quote is out there. But appreciate everyone's help, and just stay kind, stay respectful. So I would entertain a motion from the Board of Selectmen to adjourn.
I
So
move
moved.
we, a second, Lee Emery.
Moved by Selectman Edinburgh, seconded by Selectman Emery. Roll
Yes.
call vote.
I will vote to adjourn, but I just want to remind people to keep in mind that on June 14th, there will be that bell ringing moment, a minute of silence and then bell ringing again. And that also there's a vigil this Sunday down at the Bay State Green for the tragic deaths we've had through police violence.
So roll call vote. Selectman Edinburgh,
Edinburgh, yes.
Selectman Emery,
Emery, yes.
Selectman Marshall,
Marshall, yes.
Selectman Hashmi,
Yes.
and Selectman Johnson, yes. So thank you, everybody. Thank you, Westborough TV, as well as always. Thank you, Karen.
Thank you, everybody.
Thanks, everyone. Bye-bye.